everyone, good morning. I am Franz Jasmine Yap, your student nurse from Davao Doctors College. And today, I will be performing a return demonstration of a skin assessment. So skin assessment should include an actual observation of the entire body surface, including all wounds, inspection of your hair, nails, skin folds, and web spaces of your hands and feet systematically from your head to toe. So first, before doing the assessment, you should verify what we need to perform. First is to check for the patient's chart, to read the history of our client. We also need to check for the needed equipment, including the 8-inch ruler for the exact measurement, pen light for a better visualization, sterile gloves to protect ourselves from the client, and lastly, alcohol to sanitize ourselves. Remember to perform hand washing before doing the assessment. Hello ma'am, good morning. Okay lang po bang pumasok sa room mo ma'am? So it is important to ask for the patient's consent before entering the room. Hello ma'am, good morning. I am Franz, your student nurse for this morning. So by the way ma'am, can you understand me or do you want me to speak in Tagalog or Bisaya?
Yan, salamat.
Okay, so may I know about your full name?
Okay, pwede pa rin.
So what do you want me to call you?
Anything you want.
Okay. So Althea, when is your birthday?
February 16, 2000.
So is it okay that I'm going to hold your hand to check for your wristband? So now it is important, or now that we know that the client can understand us, it is important to verify for the client's identity and of course ask the client on how they would like to call during the assessment. So now that we already know the patient's identity or the client's identity, it is important to explain the procedure to the client so that they will know how they can participate during the assessment. So Althea, the procedure that I will be doing is that I will be checking some part of your hair, skin and nails, and also I will be touching some part of your skin, and there's a procedure or movement that you should follow. Is it okay with you?
Yes.
Okay, if you feel uncomfortable, feel free to raise your concerns, and the information that I will be getting is secured and will be safely handed to the doctors. So am I all clear or do I need to repeat it for you?
All clear.
Thank you so much. So now we will proceed to the current complaints of the client. So Althea, do you currently experiencing skin problems such as pigmentation, dryness, or swelling? What aggravates and relates to it?
No.
Okay. So are you experiencing some skin problems now?
No.
Okay. So any allergic reaction to food or medications?
No.
So are you using skincare products now or lotions?
Regular skin products lang.
So does anyone in your family has these skin problems?
No.
Okay. So thank you for that, Althea. So now we will proceed to the assessing your skin. Is it okay with you?
Yes, ma'am.
So before proceeding in the assessment, as you can see, I am using gloves to protect myself from the client. So now, upon inspecting the scalp and the hair for color and conditions, divide the hair like this, as you can see that, 1 inch, and then palpate the skin or palpate the scalp. Check for any cleanliness, for the dryness and oiliness, lesions or any parasites, and of course, check for a unusual growth of the body. So now I will proceed to the nail grooming and cleanliness, but first I'm gonna remove my gloves. So palpate the nail to assess the texture and consistency. To test the capillary refill of the nail beds, so press the nail and and watch the color to change. So for inspecting the color and skin integrity, look for any color variations such as redness, pallor, or jaundice. And of course, upon examining, note for any odor emanating of the skin. So for the moisture, palpate the skin and check for skin folds and unexposed areas. For the temperature, I will use the dorsal surface of my hand to palpate the skin, like this. So for the texture, I will use the palmar surface of my hands. To assess the turgor, pinch the skin and note the speed on how it lifts up. And of course, for the mobility, noting the ease of which it lifts up. So lastly, for the lesions and edema, if there is none, then don't examine, but if it has, follow the ABCDE method, which is the asymmetry, irregular border, the color, diameter, and elevation. The last thing is that to summarize the information obtained during the working phase, of course, discuss the findings to the client, provide the client opportunity to ask or raise for her concerns, and of course, don't forget to thank the client for her time and cooperation and do the proper hand washing after the assessment, and of course, document the findings of the client's record. So in my patient, this is her last day of examination, and for my follow-up assessment, it shows that she is all good and normal, and the doctor decided that she can be discharged. So Althea, you are all good and normal now, and you can go home later this afternoon. So any questions or clarifications?
None so far.
Okay, so Althea, thank you for your time and cooperation. I am happy that you are all good and normal now, so don't forget to do the proper hygiene and stay hydrated.
Thank you.
Okay, thank you so much, ma'am, and have a nice day. So that's all for my return demonstration of skin assessment. Again, I am friends Jasmine Yap, your student nurse from Davao Doctors College.